Hello friends, let's enjoy Dr. Y chest radiology. I'm Dr. Y, chest radiologist, medical professor in South Korea. Today's is session 39, smoking related pulmonary disease. Let's enjoy the images of smoking related pulmonary disease. Let's go. Smoking related lung disease. A respiratory manifestation of disease that are related to smoking of tobacco. Smoking affects the lung in many ways and can be classified under the following names. There are 4 types of smoking-related lung disease. A. Smoking-related interstitial lung disease. B. Others. C. Lung cancer. D. Chronic obstructive pulmonary disease, so-called COPD. A. In smoking-related ILD, there are 4 names of lung disease. 1 is respiratory bronchiolitis. 2. Respiratory bronchiolitis interstitial lung disease. 3. Desquamative interstitial pneumonitis, DIP. 4. Pulmonary Langerhans cell histiocytosis, PLCH. In B. Others, there are 3 diseases. 1 is idiopathic pulmonary fibrosis, so-called IPF. 2. Combined pulmonary fibrosis and emphysema, CPFE. 3. Acute eosinophilic pneumonia, AEP. C. In cancer, there is lung cancer, the most terrible lung cancer. In D. Chronic obstructive pulmonary disease, COPD, there are 2 diseases. First, emphysema. Second, chronic bronchitis. Sometimes we add bronchial asthma. Now, let's enjoy the scenic drive of Grand Canyon. Wonderful images of smoking-related lung disease. First, respiratory bronchiolitis or respiratory bronchiolitis interstitial lung disease. Both with the same findings: upper lobe dominancy, ground glass opacity, poorly defined centrilobular nodules. Lung window setting, axial image of apex. Do you see upper lobe dominance, ground glass nodule, ill-defined, poorly defined centrilobular nodules? This is RB, ILD, or RB. Next, desquamative interstitial pneumonitis. This disease is rare, very rare, and more rarer to be proven on pathology, so just on scripts. DIP is an interstitial pneumonia closely related to and thought to be represented the end stage of RB-ILD. This is associated with very heavy smoking. This is one of the rarest of form of idiopathic interstitial pneumonitis. It shows male predilection. It is characterized by diffuse ground glass opacity, bilateral symmetric dominance, basal and peripheral dominance. Can you imagine the findings? Next is pulmonary Langerhans cell histiocytosis, PLCH. Many small nodules and cavitated nodules or cysts coexist. Upper lobe or middle lobe dominance. This is a young man's chest CT, thin section, axial, lung window setting CT from up to middle lung. Small nodules, small cavity. small cavity or cysts, small cavity. They disappeared after 2 months follow-up. Young man, heavy smoker. This is idiopathic pulmonary fibrosis, IPF. This is a coronal CT of thin section lung window setting imaging, just compared with chest radiograph. Same findings, almost same findings. Fibrosis, honeycomb, fibrosis, honeycomb, fibrosis, honeycomb, honeycomb, basal dominancy, posterior dominancy, subpleural dominancy, honeycomb lung. This is the famous IPF. He used to be a heavy smoker of old-aged man. This one is combined pulmonary fibrosis and emphysema, CPFE, so-called upper lobe emphysema and lower lobe fibrosis. How do you think about the name of this disease? Is a unique single disease or two diseases triggered by smoking at the wrong time, wrong place? I don't know. Just think again, please. Upper lobe shows emphysema. Upper lobe shows emphysema. Lower lobe shows honeycombing. Honeycombing. This coronal thin section lung window setting shows upper lobe emphysema, almost panlobular emphysema, and basal dominance honeycomb of IPF. This is named combined pulmonary fibrosis and emphysema. This is a somewhat unique disease, acute eosinophilic pneumonia, young man or young woman, first smoked, not chronic heavy smoker, just smoked several days. This chest radiograph shows interstitial edema bilateral and ground glass opacity bilateral. On the CT, we see bilateral small pleural effusion, interstitial edema, bronchovascular thickening, alveolar edema, septal thickening of interstitial edema. It is transient disease, usually occurred from first exposure to smoking and surely relieved, surely go out. The most terrible, the most notorious disease from smoking, smoking-related pulmonary disease. The bad guy is lung cancer, especially small cell lung cancer. We see bilateral, mediastinal bulging, widening of lymph node masses, both hilar bulging masses, left upper lobe mass, all are showing us IM small cell lung cancer. On this axial contrast enhanced CT, we see the primary lung cancer of small cell lung cancer here in hilar and mediastinal bilateral adenopathy of small cell lung cancer. Small cell lung cancer is surely famous for smoking-related lung cancer. Emphysema, one of the forms of COPD. This left side CT, thin section lung window setting CT, shows severe form of centrilobular emphysema. Centrilobular emphysema. This peripheral portion is looking normal. This portion shows normal, but other areas shows centrilobular emphysema of severe form. And this will finally go to this form, the panlobular emphysema. Nothing left. Everywhere is panlobular emphysema. Look at this coronal image of a thin section lung window setting. Upper lobe dominant lesion Lower lobe shows relatively normal findings. This is panlobular emphysema from smoking. There is no normal lung left or pathologic lung here. And the next one is chronic bronchitis. Actually, chronic bronchitis and emphysema are not separate. They are usually combined. Look at this right upper lobe, anterior segmental bronchus. Irregularly narrowed and thickened wall of bronchus. This wall shows irregular thickening of bronchus. Chronic bronchitis. Of these two paintings, which do you like better? Which do you prefer? Same painter, Dutch painter, Van Gogh. I like sunflower very much. Yellow, strong yellow color. I don't like left side scar smoking. How do you think? E-cigarette. Many people, especially young people, prefer e-cigarette than tobacco smoking. But I'm saying to you, surely I can say to you, whatever you say, it's just another form of a cigarette. It has every risk of cigarette smoking, maybe more than tobacco smoking. Have you ever seen the green leaves like these on the field? What are these? Are these nice vegetables or poison? Just like poison ivy. Subscribe. Thank you for your warm heart. Do you remember me? I used to be a Marlboro man. I'm Wayne McLaren. Tobacco will kill you, and I am living proof of it. Actually, many Marlboro men died due to lung cancer or COPD. There are no Marlboro men now on the Marlboro cigarette pack. Cigarette smoking and lung cancer risk. Number one risk factor for lung cancer, linked to 80 to 90% of lung cancer death. Cigarettes and pipes also increases the risk. Tobacco smoke is a toxic mixture. More than 7,000 chemicals and 70 are already proven as carcinogens. Smokers are 15 to 30 times more likely to get lung cancer. A few cigarettes a day also increases the risk. The more years and the more cigarettes per day, the more risk. Quit smoking at any time can lower the risk. Can cause cancer almost anywhere in body, for example, mouth, throat, esophagus, stomach, colon, rectum, liver, pancreas, larynx, lung, kidney, urinary bladder, cervix, and AML. How to avoid the lung cancer? You can reduce your risk if you A. Don't smoke. Don't start smoking. B. Stop smoking right now, not tomorrow. C. Avoid secondhand smoke. And then check your home for radon, avoid other carcinogens at work, eat a diet of fruits and vegetables, healthy diet, exercise most of the days. This is a test for you. How to quit smoking? Please answer correctly. A. Right now. B. Slowly, progressively decrease the amount of smoking. C. E-cigarette replacement. D. Visit clinic. E. Life is destined. Don't bother me. F. I'll never stop. The only pleasure of my life is smoking. What is your answer? Correct. right now is the right answer. Live healthy and long. A. Walk. Anytime, anywhere, just walk. B. Don't smoke. Don't smoke. C. Smile as many as possible. D. Healthy food. E. Drink water as many as possible. F. Less alcohol. G. Good night's sleep. H. Manage emotion. Control my emotion. Have you ever watched the YouTube commercial of your brainer? I recommend you to watch this YouTube video. Your brainer is telling us in 1985 when he was dying due to lung cancer. Now that I'm gone, I tell you, don't smoke. Whatever you do, just don't smoke. How about the session? Did you enjoy this session? Okay, wonderful. Subscribe? Good. We'll make your next session wonderfully by Dr. Y. Thank you very much and have a good day.